Hello everyone, it's Dr. Nerofundia. A lot of 49ers fans have questions about oblique and rib injuries after hearing the news that Christian McCaffrey may have suffered an injury to this area against the Cleveland Browns. Here's a quick breakdown of some of the terminology, what these muscles actually do, what's typically undertaken in terms of a workup, treatment principles, and what the general return play timelines are. Now, the first important thing to understand is that whenever an athlete has pain in the rib cage area, particularly if they're playing a contact sport like football, you always, number one, want to rule out if there's an injury to the oblique muscles or to the rib cage. The general first step in the workup is to make sure there's not a rib fracture present, and you can see very obvious rib fractures on an x-ray, but sometimes you can't see a rib fracture in that area, or you're more concerned about an injury to the oblique muscle itself. Now, what exactly are the oblique muscles? There are two main oblique muscles. There's an external oblique and an internal oblique. And what these muscles actually do is help with flexion of the trunk and rotation. It can be very painful to do those activities if you have an injury to the oblique muscle. Now, because athletes complain of pain in the rib cage and if x-rays are negative, then it can be hard to differentiate out. Is there potentially a small rib fracture that you can't see on x-ray? Is this an injury to the oblique muscle itself? Or is there an injury to the rib cartilage? So typically if athletes definitely have pain and the x-rays aren't very obvious, then you'll move on to an MRI. The MRI can characterize and see if there is potentially a small fracture in the ribs. It can grade the injury to the oblique muscles, and that's basically graded 1 to 3. Microscopic tear, grade 2 would be a partial tear, and grade 3 is a complete tear. It also make sure that you can see if there's any injury to the rib cartilage, which you can't see on the x-ray. Now, once an athlete basically has been diagnosed with either a rib fracture or a rib cartilage injury or an injury to the oblique muscles, the return to play is really determined based on the degree of injury to the muscle or the bone or the combination of both. In general, the mainstays of treatment for this are pain control, maintaining mobility, and making sure an athlete can functionally do what they need to do. Now, because the oblique muscles are very important for twisting as well as flexing the trunk, for an athlete that plays a position like running back or wide receiver who's also receiving contact, many times, even if you can get pain control, they may not be effective because that ability to control the trunk is compromised. Now, in very minor oblique injuries that don't necessarily have an associated rib fracture or cartilage injury, sometimes that can be as quick as a week. Sometimes with more severe injuries, it can be 4 to 6 weeks. But the MRI will help determine the diagnosis and the return to play timeline in combination with how the athlete is actually feeling. You also have to take into consideration the risk of re-injury and making things worse, particularly if there's bone or cartilage involved as well too. Now, there is good data in terms of Major League Baseball players in terms of how long it takes them to come back from oblique injuries. Typically, you see about 2 to 3 weeks in terms of Major League Baseball players. And obviously, they're using their body differently. Throwing and hitting has a lot more trunk rotation than necessarily a football player has on a play-by-play basis, so their time to return to play can sometimes be a little bit longer than a football player. But obviously, the exact diagnosis and what the MRI actually shows will help determine that. The key is differentiating out the degree of oblique injury, if there's any bony involvement in terms of the rib itself, and also looking at the rib cartilage that helps to determine the return to play for this injury to this general area of the body. Thank you.